You are watching P4U Healthcare. It's new thinking.
The passing of the GST, Goods and Services Tax Bill, has grabbed the attention of the country across all the industries. It would benefit most of the sectors and make the taxation process easier, as it will replace a number of different taxes and duties. Now in this video, I will explain what impact it will have on healthcare sector in India. Before proceeding with the tax details in health sector, let us know, what is GST? GST stands for Goods and Services Tax. It is an indirect tax applicable throughout India. It has replaced multiple taxes levied by the central and state governments. It is projected by the government to be India's biggest tax reform in 70 years of independence. Now coming back to health sector, for easy understanding, let me divide the healthcare into 4 sub-sectors and I will explain what it means for each sub-sector. 1. Healthcare professionals and hospitals. Healthcare professionals and hospitals will continue to be exempt from taxation under GST. So it's all cheers for healthcare professionals and hospitals. 2. Pharmaceutical sector. India is the largest producer for generics, and the country's pharmaceutical industry is currently the 3rd largest in the world in terms of volume and ranks 14th in terms of value. On broad terms, it would help the industry by streamlining the taxation structure, since 8 different types of taxes are imposed on the pharmaceutical industry today. The biggest advantage for the companies would be the reduction in the overall transaction costs with the withdrawal of CST, Central Sales Tax. Previously, the average VAT rate for most of the pharmaceutical products was around 5%, and for the formulations it was 9%. The excise duty charged on pharma products was 12.5%. Currently, GST rate on pharmaceutical products fall under 3 categories: 0%, 5% and 12%. 0% GST is applicable on human blood and its components, all types of contraceptives. 5% GST is applicable on animal or human blood vaccines, diagnostic kit for all types of hepatitis, cyclosporin, oral rehydration salts, medicines, including veterinary medicines, used in biochemical systems and not bearing any brand name. 12% GST is applicable on medicines made by mixing 2 or more constituents for therapeutic or prophylactic uses, including Ayurvedic medicines, wadding gauge, bandages, and similar articles. Forms or packing for retail sale regarding surgical, dental or veterinary purposes. Pharmaceutical goods specified, such as sterile laminaria, dental adhesion barriers, etc. Most of the drugs mentioned under the 5% bracket are used to cure malaria, HIV/AIDS, tuberculosis, and diabetes, which were previously charged VAT around 4%. 3. Surgical equipments and machineries. The GST Council has fixed 12% rate for medical equipments. High-end medical equipments, which attracted 12.63% tax, will now be taxed 17.28%. Disposables and reagents are now bracketed under 12% GST. The old tax rate for these items varied between 2% to 5.5%. Healthcare devices and accessories such as catheters, which were charged 10.16%, will now be taxed 23.15%. Hospital beds were taxed 11%, now they will be taxed 18%. 4. Other healthcare-related services. Diagnostic services to cost more. While healthcare is exempt on taxes, the flip side is ancillary medical procedures and diagnostics, which play a key role in treatment, have been put under the 12% and 18% slab. This means, cost of diagnostic services will go up considerably. Under GST, the input costs of hospitals will increase as tax on services like housekeeping and security has increased. Comprehensive maintenance contract will now attract 18% from 8% earlier. Labor contract will now attract 18% GST rate from previous 15%. This will add significant expenditure to hospitals. Health insurance will also attract 18% GST. Considering low penetration of insurance in the country, GST rate of 18% on insurance will adversely affect its penetration. 28% for accessories like inverters and refrigerators. The preventive healthcare, which is one of the key focus areas of the government, will become costly as the health checkup attracts 18% tax. The only relief here is that luxury tax on room charges has been subsumed into GST, and hence, patients will no longer be charged a separate luxury tax. Hospitals falling under 0 slab of GST may not get input tax credit, they are likely to pass on the additional tax burden to patients. The bottom line. In general, healthcare industry would profit from the GST implementation, as it would diminish the complexities and various obstacles to the growth of business. Healthcare sector including the medical tourism is on the way of expanded profitability and promising development. However, the overall cost of healthcare will increase as tax on inputs of hospitals including equipment, accessories and services such as maintenance of equipment and labor contracts, has increased. Thanks for watching the video guys. I would love to see you leave a comment about the next video you wanna see. If you just stumbled upon this video, feel free to subscribe for more awesome content. This is Dr. Prashant and you have been watching P4U Healthcare. Catch you again soon for the next video. Cheers friends, have good time.